Hello, my name is Dr. A Lindquist, and I am Chief of Geriatrics at Northwestern Medicine. So the title of my abstract is Choosing Unwisely, Dissemination Needs of Primary Care Providers of Alzheimer's Disease. What we did is that Choosing Wisely is a well-known, well-established set of best practice guidelines that have been around for a long time, since 2014. And they've been set up so that people know what the best practices are in geriatrics. We went and created clinical scenarios or case studies for people that would reflect some of the choices you would make using the Choosing Wisely guidelines. And so a bunch of geriatric experts came up with cases, and then we partnered with the Pri-Med LLC CME Corporation. It's a large group that does CME productions for different providers throughout the country, and it's a national group. And so what they did is that they took our cases in a survey and they sent it out to all of their users across all 50 states. The results that we obtained were that we had responses from 41 of 50 states, and 211 providers responded, with the majority being physicians who are either internal medicine doctors or family practice doctors, as well as a good showing of physician assistants, as well as nurse practitioners. And what we found was that not everyone is following the best practice evidence-based clinical provider recommendations, which kind of surprised me. What we found was that people were making mistakes when it came to ordering antibiotics. About 56% ordered inappropriate antibiotics. The survey was sent to a national audience of Pri-Med CME users. And of those providers, we had 211 people respond from 41 different states. And in response, it was a mixed method survey that we had sent out with both questions that were objective, which there was a correct answer and an incorrect answer, as well as qualitative answers, which is where people gave us the reason why they picked something. So what we figured out as we were going through these analyses is that people still make mistakes. And these are community-based primary care providers that take care of patients with Alzheimer's. And what we saw was when you go back and look at the Choosing Wisely campaign, there's a recommendation not to order urinalysis for people that have Alzheimer's and mental status changes alone. And what we found was over 50% of people were still ordering UAs for memory loss or for mental status changes, which is not the correct process. We also found people that were ordering antibiotics to treat lab values instead of symptoms, which is not something that's recommended. We always recommend people take antibiotics when there's a need. And then the one that scared me the most and made me the most upset was that there were still about 11% of primary care providers that were telling people or advising people to put gastric tubes in end-stage dementia patients, which is not a recommendation. There's no utility to putting in a gastric tube in an end-stage dementia patient. Or a patient with end-stage Alzheimer's. And so there's definitely a need for us to do more dissemination, especially in the community, especially to community-based providers, because they're not getting as much geriatrics knowledge, training, and pretty much knowledge of the guidelines that are considered best practice in geriatrics. Because ultimately we want our patients, our seniors, to be getting the best care, no matter where they are, if they're in rural America, suburban, or downtown Chicago, which is where Northwestern Medicine is.